I know that this is the Thanksgiving month, and I know sometimes it's a little hard for us to find things to say we're thankful for, particularly this year of 2020, when we've had so many different challenges, not the least of which is this pandemic, which is impacting every aspect of our lives. But I hope that we understand that there's still a lot to be grateful for. There's probably, all things considered, never been a better time to be alive and be here in Utah, in this country, than there is today. We have a lot of good things going for us in spite of the pandemic and the challenges we face. So I know we're looking for a new year and a new beginning, but let's be grateful for what we have today. I'm grateful for the media that takes the time to make sure we have opportunities to have discussion and inform the public about some of the challenges and things we're doing today. As I think about the challenges, I know we're looking forward to the Thanksgiving Day celebration, a weekend of family gatherings and friends and family. And I know the concern is, what are we going to be doing with the coronavirus and the pandemics going on? What is it going to be the opportunities for us to associate their families? And let me just say, from the governor's perspective, from the state of Utah's perspective, we want you to have a happy holiday season. Not just Thanksgiving, but the Christmas and holiday season of December, the new year that's coming up. But we want you to not only have a happy, but we want you to have a safe holiday season. So we're going to make some modifications to our order when it comes to those who can gather in households. And but at the same time, with that modification, we're going to give you some good guidance and good counsel of what you should be doing to minimize the risk to yourself and your family when it comes to catching, spreading the COVID-19 virus. And so those are not anything revolutionary, but let me just go through the guidelines that we have for you to follow. We know that the more people who gather together in an interaction, the closer that you have of physical interaction, the longer that interaction lasts, the more risky that situation becomes in catching and spreading COVID-19. So we ought to try to minimize those things in everything that we do, particularly during the holiday season. So in order to have the safest holiday gathering possible, you should, in fact, gather with only those members of your own home, in your own household. Those that come to you from out of state bring more risk. Those that come from out of town, from out of the household, create more risk. You should, in fact, require that people wear masks and social distance. Again, that helps to minimize the risk. So keep it small, the numbers that you gather with over this Thanksgiving holiday weekend. If you have people that are sick, they obviously shouldn't come. If they've been exposed to COVID-19, they shouldn't come. If they tested positive, they shouldn't come to the family or friendly gathering that you have here this Thanksgiving time of year. Physical distancing should be the norm, and mask would be just kind of a belt and a suspenders type of an approach, which is a good option for you also. Seating arrangements that you have around the table as you carve up the turkey and have your Thanksgiving gathering and get together should, in fact, have social distancing in advance, so people will start in the right position and not have to slide their chairs around. Also, the time, rather than have it an all-day affair, maybe it should be shorter. The shorter you can do it, again, the less risk is involved in that gathering. We would also recommend that you gather outside. Now, some parts of the state, that's easier than others. Down south, a little easier to have warmer weather. You could gather outside. But even if you gather inside here in the northern part of the state, you ought to have proper ventilation. Turn on the fans, open the windows, have a circulation of the air. That makes it less risky in the spread of the coronavirus. And clearly the hygiene is important. Washing of your hands, have hand sanitizer. Those that prepare the food, they should be just probably as much as you can, one person preparing and serving the food, and that should be done with somebody that has a mask that they're in fact wearing at the time. So avoid potluck types of dinners, which is, I know, kind of a normal thing for Thanksgiving, but this is not a normal Thanksgiving time. We're trying to, again, make sure you have an enjoyable Thanksgiving. Share with family, friends as you can, but limit the size and follow these recommendations. And by the way, if you want to see a list of these, and there's more than what I've just given to you, you can go to coronavirus.utah.gov/holidays, coronavirus.utah.gov/holidays, and you'll have a list of recommendations of how you can conduct a safe holiday gathering with family and friends. I know it's inconvenient and it's hard sometimes to be extra cautious. It's not the norm, but it's what we need to do to get through this troubled time and get into 2021. I think it's going to be a happy new year for us for a lot of reasons. Maybe some of those things we'll talk about in our discussion here today, but happy holidays. Enjoy the blessings that we have here. Appreciate what we have, and let's work together to get through this coronavirus. With that, we'll open up to questions.
All right, thank you, Governor. We would first like to open it up for questions here with reporters in the studio.
Governor, at this point, do you believe that people are going to even heed your advice on Thanksgiving and, just only socialize with their households? Do you have plans if you start seeing a surge in cases as a result of Thanksgiving?
Well, I think, Ben, that people are heeding the advice and counsel of our medical experts. I'm just kind of the spokesperson for the best minds and best ideas and thinking we have in the state of Utah of how we navigate this coronavirus. And I think people are. We have what's called the HERO project, where we actually go out and observe. It's like a polling mechanism. And certainly more people are, for example, wearing masks. More people are taking this serious. They're concerned. They're having social distancing. Businesses are complying of their own volition. So yes, I think people will, in fact, modify their behavior. Will everybody? Probably not. That may be just some of human nature, but I expect enough people will do this that we'll have a better time than if we just disregard these recommendations and good counsel from our medical health care advisors.
So at this point, what are you doing about public health orders that expire on the 23rd? I understand you're extending them.
Well, you're wrong in that we're not extending all of them. The mask mandate will continue to be extended, for example. That will continue. That's good for us to help. The science is clear that it helps slow the spread, modify the spread, increases our ability, and minimizes risk by about 70%. Doesn't mean there's no risk, and people can certainly still catch the COVID-19 if they're wearing a mask, but it just minimizes that risk. It also allows people to go out and shop. People that wear masks feel comfortable, they feel safe, and as we've done this as a community, the data is now showing that people with a statewide mask mandate are getting out and about. Their mobility is now increasing, which means they're actually more engaged in the economy. And it's not only does it not have a negative effect on the economy, it probably has a positive effect on the economy to have a statewide mask mandate. So that's going to continue. The one that's going to be modified and changed is the requirement to have only household eat together, for example, those within the confines of your four walls. We're taking that out of the order. What you do in the confines of your own home is going to be up to you. But we also are given strong recommendations of how you can conduct that in a safe environment. So some will be extended and some will not. We'll have that ready to present in its entirety this next Monday.
Governor, a couple of questions. One, what do you say to people who would say this advice for Thanksgiving in your own home goes too far? And two, you've had mask recommendations, social distancing, mask mandates in hotspots, mask mandate across the state, mask mandate in schools, lots of restrictions, and yet the case counts go up. How do you explain that?
Well, I don't have an explanation for all of it, Brian, but I can tell you that we can look around the country and we find that nobody seems to have an explanation for it. We've tried a variety of different approaches, none of which seems to be working. We've had the approaches of do nothing, like in South Dakota, which some have pointed to as that we ought to be more like South Dakota. They're the number 3 highest death rate in the world now. Their infection rates are through the roof. North Dakota's number 1 in the world. So that's probably not the best model to follow. New York has low case counts now, but they've had a high death rate in advance of that, which has helped them lower the case numbers. I talked to Governor Cuomo here just the other day. They're starting to shut things down again. And again, when their death rate is about 170 per 100,000 and ours is less than 20, I'm saying, well, maybe we're on the right side of this issue as we've tried to navigate to maintain everything we can do to protect people's health. But at the same time, keep the economy open. And we're one of the best performing economies in America today. So on balance, we've done a pretty good job. Is it the right formula? I don't know. It's one formula. And we're trying to do the best we can with the best medical advice we have available to us here in the state of Utah.
Governor,
What about the other question, Governor? The notion that I think some people may have after hearing your words today, that this simply goes too far. Telling you what you can do inside your own house, or at least advising people what they can do on the inside their own house, may be a bridge too far. How do you respond to that?
Well, let me just say again, we're giving you good health care recommendations. This is what the science tells us. Again, we've had the order that we put in place about limiting your social gatherings to just members of your household. That would be outside of your home, but also inside your home. That will, in fact, be expiring this coming Monday. So we're not saying to anybody, this is what you should do or mandated to do inside your own home. That being the case, we would like you to not smoke tobacco inside your own home either. It's not only hazardous to your health, but it's hazardous to the people around you. It's health with secondhand smoke. Or you do what you want, but that's not the good counsel and recommendations from the healthcare experts. Well, this is a similar thing. We have this unique coronavirus. It's very infectious. It's more deadly than the flu. Just to give you a comparison, Brian, on one of our most deadly years, 2017, 2018, for the flu, we had about 94 deaths in that entire year. We have 740 in 8 months here in the state of Utah with this pandemic and COVID-19. And we don't know as much about it. So better safe than sorry. The medical experts are saying limit your gatherings. Your social environment should be fewer people. And you should have social distancing, wear a mask. That's just good counsel. Whether people heed the counsel, I guess, remains to be seen. But we're giving you the best advice that medicine and science has to offer to now, and we'd be derelict if we did not pass that on to you.
Governor, how is distributing tests to colleges and universities going? Back when you announced the new public health order, I think it was you or Dr. Dunn mentioned that the federal government had said that they were going to assist in getting more rapid tests to universities so that they would be able to meet that requirement that you set of testing students weekly by January. A colleague of mine heard from Dixie State that they've just got around 2,000 tests, which is not nearly enough for their student body. So I guess my question is, have the universities, to your knowledge, gotten the test that the federal government promised you, the state? And if not, what are you doing to try to catch up to that?
Well, I'm glad you asked the question. There's certainly a lot of rumors going on out there. And if you don't like the one you've heard now, wait till tomorrow and you'll have a different one. We have received, are in the process of receiving about 400,000 tests. We would like to get to the point where we can test 250,000 tests a week. We've been in constant communication with our higher education presidents and the leaders of our universities and colleges, community colleges, technical colleges, et cetera, with the idea that hopefully in the next couple of weeks we're going to be able to have this acute testing. And we've talked to Dr. Birx, we've talked to Dr. Redfield from the CDC, and those tests are on their way towards us. And so I think we're going to be able to do that. We hopefully be able to kick that off, certainly by the first of the year, if not within the next couple of weeks. Now we got holidays, Christmas vacations coming up, and so the logistics of that are yet to be worked out. But I expect here in the next 2 weeks we're going to be able to lay out a program where all of our those who are having classes at our universities and colleges, et cetera, those that stay at the dormitories will be able to be tested at least every other week. And that's the plan, and I see no reason why that's not going to happen.
Okay, we do have some journalists joining us remotely. We would first like to go to Chris for a question. Chris, go ahead.
Thank you, Governor, and a very good morning to you.
Thank you.
As you know, you mentioned. Thank you. As you know, you mentioned about the mask mandate continuing, and there's still a lot of questions about the enforcement of that mandate. Down here in southern Utah, as you certainly know, the Iron County Sheriff and Iron County supervisors have been critical, and one of the things they say is that you haven't come to the table with the Utah Sheriff's Association on discussing any kind of enforcement. Is that something you're considering?
You know, I haven't been invited. I've worked with the sheriffs a lot when I was a county commissioner. Again, I have a great appreciation for the responsibility of law enforcement. The policy and the laws are created by the legislative body, and in this particular circumstance with the Department of Health, again, under our statutes that have been created by the legislature. So some of the orders we have in place are being put in place because of authorization to do so. I know Channel 13, to throw a bouquet out to them, did an in-depth research as does the governor have the authority to do what he's doing? Is it constitutional? Does it follow the statutes? And the answer was yes, I do. We've made sure we had legal direction every step of the way. We can debate, I guess, different policies, but I think we're at the point where there's really no debate. The Brigham Young University study, we have more and more science that says to us that if you wear a mask, you slow the spread, you minimize the chances of you getting sick and those around you getting sick and catching the virus by approximately 70%. I'm not even sure that's debatable. People don't like to wear it, and those that disagree don't like to hear the numbers and the science behind it. That being said, how will you enforce it? We would hope that people would just do it because it's in their own best interest, and it's in the best interest of those around them. What data is also informing us, though, as we've had a statewide mandate, and we're checking around the country here, University of Utah study, which I think will be completed and maybe made available here by this next week, shows, and again, I think intuitively we'd understand this, people feel safer going to those places where, in fact, masks are being worn. And so what happens with a statewide mask mandate is there's more mobility. People are getting out and about, means they shop more. It not only does not have a negative effect on the economy, it has a positive effect on the economy. So again, just for good common sense reasons, we ought to be wearing the mask to help protect ourselves and allow us to get out and about and shop and not limit and not restrict us to our homes and home confinement. It's all about changing people's behavior, whether it has to be a rule put in place by government or the fact that we want to help our neighbors. I have a quote here that probably germane is bringing up here. Our faith-based organizations got together this past June 24th and composed a letter of encouragement to all of us as people of Utah, in fact, to wear a mask and to practice social distancing, do the proper protocols. I'll just quote from you here. It says, they say, this is a bunch of Christian, non-Christian denominations saying, we recall that the greatest commandment is to love God, and the second is like unto it, to love one's neighbor as oneself. One cannot claim to love one's neighbor while deliberately putting them at risk. We pray for the end of this devastating pandemic. However, the reality is that our actions must accompany those prayers. Again, do it because you want to do it, not just because we have a statewide mask mandate.
All right, thank you, Governor. We would now like to go to Taylor. Taylor, go ahead.
Good morning, Governor. I'm wondering if you've had any communication regarding COVID-19 with the Biden administration, and also what you would like to see from the new president to control the spread of the coronavirus.
We actually will be on a phone call with the president-elect later today. Again, a conference call with governors and President-elect Biden, and I assume the Vice President-elect Kamala Harris will be there too. I'm not certain about that. I've had the great privilege of working with the past administration, with the Trump administration, my good friend Mike Pence. But before that, I worked with the Obama administration and Vice President Joe Biden. He's very aware of Utah. He's told me on numerous occasions with admiration of the great success we've had here in Utah economically and socially. He knows Utah is a great example to the rest of the country. So I'm curious to hear what he has to say today on the phone. I know that his concern is that we, in fact, come together to fight this coronavirus in a united effort that's supportive of each other, allowing for various differences of opinions, but following the science and the medical advice that we have to guide us. I hope that he will still continue to let states conduct their own declarations and make their own recommendations to the public and our own mandates rather than a national mandate. I don't think he's going to go that direction. I hope not. I also think he's going to try to see if we can find some additional resources to help us bridge the gap between the pandemic today and the recovery of 2021, particularly helping individuals and particularly helping businesses which are struggling. Not everybody's been treated the same under this pandemic. Some businesses have actually flourished, and some have had a difficult time. The good news is our economy overall in Utah is doing very well. We're one of the lowest unemployment rates in America. We'll have new numbers coming out tomorrow, but I'm guessing that we'll have very good unemployment numbers. More people are engaged. Even those out of work are now looking for work as jobs are available. But it is the old adage that when I'm out of work, when you're out of work, it's a recession. When I'm out of work, it's a depression. So I understand the individual pain that people feel that are having a struggle. If you have problems with finding jobs in employment contact or workforce services, they will help you find and know what jobs are available. If you need additional skills and training and education to get you qualified for jobs that are on the market today, they'll help you with that too. We want to make sure everybody has an opportunity to work and pay their way in this free market system, and we'll continue to focus on that as we go through this next year.
Okay, Jacob with KSL.com, you can go ahead with your question now.
Good morning, Governor. Back toward the end of the summer, I remember hearing state officials starting to talk about ramping up testing, possibly to anyone who wanted to test, even if they had no symptoms at all. That was back in August or September, but here we are several months later, and we've seen a little bit of increase in our daily testing numbers, but not anything really substantial. Why is it taking so long for Utah to ramp up testing?
Well, that's a good question. I don't know that I can give you the answer to it because I think it has taken a long time to ramp up the tests. We've been talking about this from the beginning. It may be that the supplies have just been hard. That we want to make sure that we have a test that you can rely upon that's accurate. Our PCR testing, which is probably 90% accurate or more, is working well. The Abbott testing, the Binex testing, which is a very rapid testing system, you can get the results in 20 minutes. That's just coming on board now. Again, getting more tests is really critical. We're working with the CDC. They've controlled the test. There's been finite supply. We've also learned along that same process, though, maybe some of the urgency we feel today was not felt, in the summer, because people didn't think at the time that you could spread the virus if you did not have symptoms. That's an evolution of learning. The CDC said, yeah, you can't spread it if you don't have symptoms. Well, we found out that's false. You can spread it when you don't have symptoms. So the need now is more acute to have all people get tested, whether they have symptoms or not. So those who are asymptomatic and are spreading it get tested, and we find out, oh, you've got the virus. We need to then take steps to isolate you so you don't spread it to other people. That's part of the challenge we face today with this increasing numbers. So testing is not the end all and be all, but it's certainly part of the solution where we can find and isolate those who have the virus and stop the spread. Right now, our positivity rates are through the roof at about 24%. That's way too high. More testing will help us to find those people, isolate them, and bring that positivity rate down. And of course, the end result of this lagging is that our hospitals are being overwhelmed now with more and more demand for ICU units. It used to be 10% of ICU units in the beginning were COVID. Now it's about a third, over a third, 33 to 36%, depending on the fluctuations, and rising. And we have right now the sad commentary is that of all of our ICU beds in the state of Utah, we have about 45 that are still vacant today available. And that's not just for COVID victims, that's for people that have accidents, that have other kinds of trauma, heart surgery, cancer surgery, that need to have an ICU room that has the capability of providing them with the highest quality care available. And so that's why the hospitals and the medical profession is very concerned about this overwhelming of our healthcare system. So again, testing is going to help us. We're going to try to get to 250,000 tests per week, and testing our students, our teachers, healthcare professionals, those that are vulnerable. We're going to try to do as much of that as we can, as rapidly as we can.
Okay, thank you so much, Governor. Do you have any quick final thoughts on Thanksgiving next week for our Utahns on the holiday?
Well, I hope we all appreciate that we have a lot to be thankful for. I know 2020 has been a tough year, and we'll be glad to have that in our rearview mirror. We'll all be celebrating New Year's and say, hot diggity, we have a new year and a new beginning. And I think there's opportunity for us, in fact, to learn from the past and make sure that 2021 is a better year. But as I think about all the blessings we have in life today, the technology, the advancements in science, the quality of life that we have, the place where we live, the beauties of nature that we have here to enjoy, we ought to take a little bit of time and start counting off all the blessings that we have in spite of these challenges that we've had in 2020, particularly the COVID-19 pandemic. So take time, count your many blessings, name them one by one, and I think we'll appreciate the great time that we live here today in Utah, in this great country.